It's time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Mark Hiatt, the Executive Medical Director for Regence. Dr. Hiatt, good morning.
Good morning, Chris and Paul J.
A lot of people are trying to increase their protein intake. What's the best way to get that done?
Well, Paul J., a lot of people trying to increase their protein intake think that they need to get a lot of meat. And I'd like to say that more protein does not need to mean more meat. Certainly beef, poultry, and pork provide high-quality protein, but there are other ways to get it, namely from plants, including whole grains, beans, nuts, and vegetables. In fact, increasingly, researchers are finding that plant-based diets may actually lower the risk of certain diseases and cancers.
How frequently, doctor, should you eat protein?
Well, not all at once. It's best to really spread that protein intake throughout the day. You see, the body uses proteins, amino acids best when you eat protein in divided doses, maybe with your main meals. And it's thought that this type of distribution throughout the day is really best for building muscle and aiding fat loss.
Should you eat mainly protein?
Well, protein is good, but sometimes too much of something is not the best. And you really shouldn't let your protein intake crowd out the other important macronutrients, such as helpful carbohydrates and fats. And all this really balance is key to a healthful diet.
Doctor, if a person is determined to smoke, what would be safer, smoking tobacco or vaping?
Well, that's a tough choice to make because really both are suboptimal. But if you have to choose between the two, I believe that most health experts probably would agree that vaping, that is smoking an electronic cigarette or e-cigarette, may be safer overall. But that's not to say that it doesn't have its own safety concerns.
Why may vaping be safer?
Yeah.
Well, you see, using an e-cigarette and vaping cuts out the tobacco smoke, and it's that smoke that's associated with lung cancer because it contains harmful substances such as tar, carbon monoxide, and so really you avoid that through vaping.
Well, any risks if you vape then?
Well, if you vape, you've still got other substances that you're exposed to, in particular nicotine and certain chemicals. So the nicotine, for example, is harmful. It can damage blood vessels and lead to heart disease, putting those who vape at risk for heart attacks and strokes.
Dr. Hiatt, we've heard that a recent study surveyed physicians about over-treatment. What did the survey show?
This survey, Chris, surveyed about 2,100 physicians, and their responses were surprising in the sense that these approximately 2,100 physicians reported that about 21% of overall medical care was unnecessary. And it was interesting to me that some procedures in particular were considered to be often unnecessary, like about 50% of all cardiac stents. And so from a physician's perspective, over-treatment in this country is common.
Prescriptions too, right?
Yeah, they found in the survey about 22% of all prescription medications were unnecessary.
Doctor, why is that?
Well, you know, at least the reasons cited in the survey were very interesting. Foremost was the fear of physicians of malpractice. Secondly was a sense that their patients were expecting this treatment, that they were actually demanding or requesting treatment. And third was the difficulty of physicians in accessing outside medical records.
Are there solutions to this?
Well, there may be. As pertaining to access to those outside medical records, a solution would be easier access to those records. In terms of other things, it may be important to really train physicians as their medical residents on appropriateness criteria and to develop more practice guidelines.
Well, Dr. Hiatt, thanks for the information this morning and your time on KBOI.
Thank you.